So welcome again, everybody. My name is Taurus the Legend. Thank you again for joining us for our May edition of the SAP Fiori Practitioners Forum. We have a couple of great presentations for you today. The first one will be done by my colleague, Martin Berger. His session will be how SAP is working with public health agencies to help combat COVID-19. And then one of our partners, Dan Barton from Bluestonex, will be covering remote design thinking and cloud innovations. Before we get started, I just want to let you know of some upcoming SAP Cloud Platform webinars that are in progress. We just completed the North American supporting our customers through the global crisis with SCP in North America. That was completed yesterday. We have another one for the EMEA, the part 2, which is a whole new agenda with more partner stories and customer stories next week, May the 26th and 27th. So if you guys are interested in joining that, that's in the European time zone. Then we have a couple of sessions for those in the Asia Pacific area in June 9, 10, and 11. We have the SAP Cloud Platform and Design Innovation Southeast Asia and India webinar series. And then we have another one on in Australia, New Zealand, on June the 30th, July 1st, and July 2nd. Again, the SAP Cloud Platform and Design Innovation series. I just also want to bring to your attention the other practitioner forums that we currently have underway. My colleague Peter Spielvogel is running the Screen Personas Practitioners Forum. As you know, I'm running this one, the SAP Fiori one, but we also have the SAP UX APJ version. And then my colleagues Eugen Winchell and Keith Fisher and Jean-Luc Thierry are running a weekly SAP Fiori side chat series, which is held every Tuesday. And then we've just started a couple of new practitioners forum. One is the SAP Cloud Platform Practitioners Forum, which is held every third Tuesday of every month. And then in the month of June, we're starting the inaugural Practitioners Forum for the SAP Cloud Platform APJ. So for those who are in the APJ time zone, that'll also be held on the third Tuesday of every month, but much earlier than the other one. So if you're interested in any of these, please click on these links once you get this PowerPoint in the JAM site. Our next Practitioners Forum will be held on June the 18th. So if you have any topic ideas or demos, or you want to share your successes or challenges with our colleagues on the call, please send me an email and I will add you to an upcoming agenda. With that, I'd like to hand this over to my colleague, Martin Berger. Martin?
Thank you. I'll just start to share my screen. And let me know if you can see my slides.
Yeah, I can see your slides.
Okay, great. Thank you very much. So thanks for the introduction. So hi, good evening, everyone. My name is Martin Berger. I'm based in Singapore, and I'm part of the industry business unit within SAP for healthcare. So my role is working globally with our healthcare customers, supporting them, and especially in these times, of course, very special times to work together with them. So for the next 25 minutes, I would like to share with you a little bit of an example of how we work together with these agencies and came up with a SAP Cloud Platform and Fiori-based approach to help them during this crisis. Let's look at the current situation first. Of course, when you look at this current topic, most of the industry is heavily impacted. A lot of them had to significantly drive down their activities. Not much happening because of the lockdowns, but in healthcare, quite the opposite. So massive attention, massive focus on the healthcare providers, on the health systems to look at that. And this situation, everybody notice, we have the global ongoing crisis. We have the first countries who are already getting out of it, but it's now, especially Latin America, really picking up over there. And in general, it is the key focus of our customers there is to save lives, to make sure that the health systems, that the hospitals are able to run, that they are able to look after us as a patient. And in these times, they need to continue to make sure that those people with life-threatening situations are able to be treated. And that's one of the key things, right? So within that situation with COVID, they need to ensure to, of course, save as many lives as possible. But at the same time, it's not just COVID. You also have the normal situations that you need to some sort of handle there. A lot of our customers had quite some changes, all elective surgeries, a lot of medical procedures were stopped to really make space and focus on COVID-19. And it's amazing, this project, and please understand I'm not able to share the customer name because of confidentiality. Earlier this year, I was actually could still physically meet them, and we talked about it. We basically said, okay, how can we help? And it's amazing that even in such a situation where you could see the crisis also hitting them, that you can sit together, look at the situation, and really completely find new ways to work together, to collaborate, focus on the most immediate needs of the customer, and come up with an approach and a solution. So that's what we did. It's basically something, especially if you look at the situation, all of us, you really lack the specific information. You get a lot of information from different sources, what is true, what is not, what is reliable, and there's no clear communication channel there. And very critical for pandemics is to have real-time and geographically correctly attributed information available, so that you can know. And some cities or states in Australia basically make the approach to not go for a full lockdown, but look into a suburb by suburb lockdown based on where are the hotspots, where are the most information there. From that point of view, it's really important to have this information available to make the best possible decisions. Of course, it's not very easy, lots of complications. All of us, we are humans, and in situations where we don't know really what is happening, we tend to panic. And then we're really looking for guidance, for someone who remains calm, who gives us structure, guidance. You have this condition, you need to go there, you don't have to worry, etc. So that is really something that was missing in the initial days. And we all seen the pictures from Italy, from Spain, where the countries really hit hard, and information all over the place, and no structure initially there. Very important for our customer here was to manage the surge of demand. So if you have suddenly a whole lot of patients coming in with COVID, and on top of that, a whole lot of patients who think they have COVID, all running to the hospital, clogging up the emergency department, going to the fever clinics, going to the GP centers, they take away resources which might not be necessary for them. And that's one of the things on which I'm really happy about is the topic of increased remote and virtual assessment and activities in the healthcare sector that is happening right now. Because digitization is really something in healthcare. It's happening right now, but healthcare traditionally is an industry that is very late in adopting technology. But right now they really need to find ways to get the patients who don't have to be at the hospital, keep them at home, or keep them at locations where they are safe, but they don't use precious hospital resources. As an example, here in Singapore set up 2 or 3 specific areas in an expo center and in other areas which were currently unused, to put it up for mild cases of COVID, so that they don't have to go to the hospital, but they are still being looked after in that area. And lastly, the topic of self-isolation. One of the key topics around this is, and there we have the topic of patient tracing, which I'll come to in a minute. And that's basically the risk if you have been in close contact with a confirmed positive COVID-19 case, then you should go into a 2 weeks self-isolation or stay-at-home notice. And this is something really hard to also follow up to make sure, check that people are compliant with that. Some countries, they really send the masses to knock at the door at surprising times to make sure are they complying with it. But we have technology there that we can use that, right? And this is what we did. We built basically a solution together with the customer. And we right now have global conversations around this. It started in Australia, but it's really a global conversation that we have here. We developed a mobile app for citizens and patients, for them to get really individualized information which is relevant for them. Just think of yourself on your phone, how many messages, pop-up notifications you get about all sorts of information, and think about this one to be really individualized for you, that's what you are looking for, right? And as part of that, we needed to have a flexible platform to build this one on top of that. That's why we chose SAP Cloud Platform, and have a technology which looks good, which is user-friendly and easy to implement, and that's the Fiori apps that were used as part of that. We built a self-assessment form in there, because a lot of people at home, they're coughing, they have a little bit of a temperature. And at the beginning, everybody thought, oh my God, I have COVID. I need to run to the hospital. No, don't do this. There's a self-assessment that we struck up as an example content in a solution called Qualtrics from SAP. And the customer endorsed that content, took it over, took responsibility for it, because it's a clinical assessment. Basically triaging or saying like, what's your temperature, what is your situation, etc. And based on that, decide if you're low, medium, or high risk patient. And based on that, do some activities. And that is a clinical assessment. And either you need to be a medical device to be able to do this, which SAP is not. So the customer took over that responsibility. And in that way, with this app, it was possible to seamlessly communicate between the citizens and patients, or all of us, and the government agencies or the hospitals that are basically running and looking after the area. Okay, so from the situation, looking at it, and this is information for us, we used trustworthy sources. This is coming from the World Health Organization, and each country has dedicated health research organizations or areas where you can get trusted information from, which you can really use. And one of the things why I'm showing this one here is everybody knows it's the 2 weeks that usually a COVID case takes, but only in the second week or beginning of the second week you really see the faces, and that's where it's getting really critical. In the first couple of days you might have nothing, but you are infected, and that's where you're really in danger of infecting others. And that's why here, looking at these things, how to look at the definitions. Close contact is defined as being close to 2 meters for more than 15 minutes. And these are the things that are relevant to define for the patient tracing, which is one component of our app to develop there. But we all know COVID-19 is completely new for all of us. It's basically something every day we receive new information. We have the first immunization trials running, etc. So a lot is going on, so daily changing, and therefore you need a flexible platform. That was one reason to choose SAP Cloud Platform, to be able to sort of accommodate to this flexible requirement and be able to adjust accordingly. As mentioned earlier, the pressure on government and healthcare services was and still is immense. Really glad to see that Italy and Spain turned the corner. It's scary to see what's happening right now in Brazil, Russia, and the US. And it's really around how to make sure that disseminate the right information in a timely manner and get the spread down. Maybe avoid, if possible, the full lockdown, but really, when you have COVID in there, you need to find ways until the immunization is there to control it in other ways. And most importantly, really for the frontline workers, the nurses, the doctors, the cleaning personnel in the hospitals, all those helpers, allied health in the hospitals that are fronting to the positive COVID-19 cases, they need to be protected. They need to have PPE, personal protection equipment, available so that they can continue to spend in their time and effort there without being at major risk. So now here you get an idea of how the app is looking like. Apologies, I cannot do a live demonstration here. That's a little bit too tricky. Here you can see how the looks with the Fiori tiles looks like that we have built. And to basically have this channel to very easily send out the information to the citizens, to the patients. It also allows them to, so if I'm looking at it for myself, check my symptoms, I can use this app to document my temperature, my blood pressure, etc. How do I feel? These sort of things, because they can become very relevant. One very important thing about this activity, and it's different in every country, and this should be your very first conversation, is data privacy, data security. This is really something very important topic that needs to be addressed at the beginning, because you cannot address this in a phase 2 or phase 3. At the very beginning, this needs to be addressed. Yes, we have a pandemic, we have a crisis right now, but still we cannot suddenly forget about all the rules and just collect all the information. It's very interesting here. If I personally, I monitor closely, of course, Germany, where I still have family over there. Germany, as everybody knows, very strict on data privacy. No data to be stored centrally whatsoever. SAP is currently building their patient tracing app as asked by the government, and all the data needs to stay on the phone, nothing to be stored centrally. Of course, following the data security guidelines, but it also limits you in the ways that you can do analytics on it and to better plan and prepare for the pandemics. In the Asia region, it's a lot different. Countries are much more open. They actually want to store, governments want to store centrally data. So that's the beauty of this platform, that's quite flexible to address these different topics. How does the solution look like? So as mentioned earlier, the basis for us is the SAP Cloud Platform in HANA, where we store the details, we store the status, if it's a work person, health, or in isolation. This information of exposure and event history is stored here. Again, keep in mind data privacy, data security. At any point in time, this can be all deleted or can be exactly defined how long you want to have there. Geospatial data, because that's really the point. You want to know where are the patients, where are the citizens, and avoid the complete lockdown. And based on that, be able to better plan the activities from a government perspective and define the quarantine and movement rules. We also use, of course, with SAP Cloud Platform, our intelligent platform, including predictive analytics and machine learning, where you then really can also run intelligent scenarios on that. On top of that, a couple of different solutions that we used here. Qualtrics already mentioned for surveys, self-assessment survey, and others to reach out to the workers. We have the dashboard there to be daily stay in contact with the patients, the citizens, or even your own health workers who have to stay at home, but give them the feeling and make sure that you on a daily basis understand how they are doing. People Connect 365, since a couple of weeks, this has actually been just being sold from SAP as part of this activity to a Swedish company. But it doesn't matter, it's still completely integrated. It's basically the Sybase SMS-based solution to help around home isolation tracking. Then we built the app as such with the Fiori pieces and an admin portal for, of course, to manage everything. And the beauty why I really like this activity, and we have lots of global interest in that one, is It's a modular platform that is a comprehensive use case covering basically everything what is required during such a pandemic. You can, of course, you have countries who are saying like, yeah, in Germany we are building a patient tracing app, so we don't need a patient tracing within that area, within that solution here, or other pieces they already have in place. So you can modular address it accordingly. Taking one look a little bit deeper into the technology for those of you who are interested in that one, and please understand I'm not a very technical person, so of course if you have more detailed questions, feel free to reach out. So basically we use the Cloud Foundry for the SAP Cloud Platform and the HANA database. We also used Customer Data Cloud, formerly known as Gigia. And that is really important for the identification. It is important to know who is using this app and maybe different places, how this patient, how the citizen is accessing this information. And with Customer Data Cloud, that's a very good tool to manage and bring together different identities and make sure it doesn't matter if you go via email or via social media, other methods. It's always brought together that you are the same person, Martin Berger, accessing this one here. So in there we have defined our container and they built our Fiori app, both a mobile version and a desktop version. Of course, you always have to consider there are elderly people or people who cannot access a phone, a mobile phone, so that some care person, maybe a care team member or some family member on behalf of the person needs to enter this data. Qualtrics embedded here as a survey. We also leveraged hardware features from the relevant phones, like fingerprint or face scanning, etc. These are all things that are coming. And Bluetooth for the patient tracing. That is basically, it's pretty much, if you look at all the patient tracing activity currently ongoing, most of them use Bluetooth. Singapore was one of the first ones, the one that is built in Germany right now. If you're interested, you can look it up online. Our Chief Technology Officer, Jürgen Müller, just published this as open source on LinkedIn. And so you can all see the progress, how this is working. And at some point, this is still ongoing development, right? You can use pieces already today. Some pieces are still being finalized. We also intend to look into app stores where we then can provide this. And of course, we're always happy to hear feedback from you guys. What is your situation? Maybe you have additional ideas, and this is really something, what can we do to help the situation? Approaching my time, 5 more minutes. So one of the things that we learned as part of this one, during this crisis, patient comes through all type of different locations, right? Fever clinic, emergency department, or GP. And it's really at the beginning when the COVID-19 testing started, everything was still chaotic. It took days to receive a result. Communication was sloppy and it was not always clear. But in the meantime, especially with this customer that we built that one, defined a common process. So it doesn't matter in which place the testing is happening or the patient is facing with the health system, getting the same processes, the same methods, then identifying low or high-risk patients, and then make sure get the high-risk patients into ICU or into the hospital, and the lower-risk ones maybe get to hotels or some other areas where they are not so endangered. And final slide from my side, just to give you an idea what was then the outcome. So here, based on the platform, and I still think that patient self-assessment is one of the really best and most obvious benefits of the platform. Patients can stay at home, they can use the website, Facebook, they can call a health number, or in the clinic, scan a barcode, and then do the patient self-assessment, and based on that, then in the background, ticketing system is started within Qualtrics. As SAP Cloud Platform pulls it all together, and we have all this information there, and that really quickly gives the right information that the fever clinics can prepare accordingly, can make sure they have the right personnel, the right material for them there, and can maybe also actively reach out to the patient saying, stay at home, in 2 days we will pick you up, or we will pick you up in 1 hour, just to make sure patient citizens are looked after, the situations is getting more under control, and the patients who need the most urgent care will be immediately addressed. So that's basically it from my side. You will get the slides and my email address, so feel free to reach out. I'm really keen to hear your thoughts. Also, if you think you have maybe areas where this might be of interest of that one, or if you have similar tools. As said, of course, this is also one of many other companies and countries are all developing solution in that area. But it's a really great activity, and it was for me really great to see how in crisis mode we can work together with our customers and make quite an impact. With that, I hand it back. Thank you very much.
Okay, thank you, Martin. Thank you. So if you guys have any questions for Martin, please unmute your line and ask your question, or type your question in the chat area. Any questions for Martin? Okay, thank you so much, Martin. If you guys have any questions afterwards, just type it in, and if Martin's still on the line, he'll be able to answer your question. Thanks. I'd like to now hand it over to Dan Barton from Bluestonex.
Thank you, Taurus, and thank you, Martin, for that presentation. It was great. Taurus, can I just confirm you can hear me okay?
Yes, yeah, I can see your screen too.
Good stuff. Okay, right. Yeah, good afternoon, I guess, or good morning, or wherever people have joined from. So, yeah, today we're just going to run through a session around remote design thinking and cloud innovation. We're actually going to talk about, obviously, COVID-19, which has impacted all of us, but the way we've had to adapt our kind of business model, and also to kind of show you we've had to practice what we preach in regards of the systems and internal processes that we use within Bluestonex. So we're going to walk you through that. So I won't labor too much on these points. Hopefully some of you guys have heard about us. We're a UK-based company formed in 2012 in the Midland area of the UK. We also have a small office out in India, 21 full-time employees. And obviously the X in Bluestonex, we focus on innovation and user experience. We do actually hire designers as well, so we do have that design skill in-house. In terms of the services that we offer, yeah, as you'd expect, end-to-end user experience services from design prototype right through to health checks, support desks, whether that be for on-prem or SAP Cloud Platform, or whether it be your own cloud platform, or even via the App Store. So we put apps onto the App Store as well. We're proud to announce that we are now part of the App House network. So one, I think, of 11 partners globally. So there's our own pictogram, App House Shropshire, which is a county in the UK. And this is our design centre, which unfortunately is closed at the moment due to COVID-19. And this is what little bit I'm gonna touch on with when it comes to remote design thinking. Yeah, I won't go into this. This is how our revenue is split. 50% of our business and employees are focused on innovation in the cloud platform, and 50% are focused on a product that we brought to market for SAP Master Data Management. So the subject of remote design thinking then. Obviously, yeah, great presentation as well from Martin on what SAP have been working on there. But I think it's fair to say we've all had to adapt and evolve around the pandemic of COVID-19. I'm hoping that there'll be some good stuff that comes out of this. You know, in the end, we'll all sort of cherish interaction and certainly appreciate what was there before. I can certainly say as well, things like environmental impacts have been pretty immense as well. yeah, so brings me on to the future of working. Bluestonex, as I'm sure everybody else in this kind of industry, we've had to change. Unfortunately, you know, with the support of some great software tools such as Microsoft Teams or Zoom, we're able to continue. So we are in the new abnormal. And this is my prediction only, really, that I believe that things will shift to that new abnormal, and it will become more flexible working rather than the commute into the office 5 days a week. I think initially when COVID-19 hit, I think I, for one, thought long and hard about it, but now after a few weeks I've had time to reflect, and yeah, I believe things will slowly get back to normal, but will never become what it was. So this is why remote design thinking and innovation becomes, you know, more and more important. We need to work, you know, we need to work smarter and in different ways. So I'm sure you guys, again, you'll all be familiar with the design thinking methodology, which is, yeah, fairly standard, especially when you talk about human-centered design and things like this. One of the impacts of COVID-19, and it's a challenge which we'll talk about, but we also have a usability lab. So when we do our ideation, prototyping, we sit down with users, we actually do a lot of body language and interaction with users in the lab. Yeah, so that at this moment in time is a bit of a struggle, and that's been a clear impact for us. But I thought I'd put this together and let you guys digest it. I have put a few notes on LinkedIn as well. But this is to kind of give you an idea of how we're dealing with, you know, trying to continue in the new abnormal. So there are a bunch of software tools out there, as you can see. We predominantly use Microsoft Teams in day-to-day communication, meetings, workshops, things like that. But in terms of brainstorming and ideation, for those of you that don't know, have a look at Mural. We think it's really good, very easy to use. So again, yeah, I'd urge you guys to have a look at this stuff. Obviously, as part of your design thinking, you normally look for user feedback. Yeah, so observation is clearly quite a difficult thing to do over video. It's a lot easier to actually see it in its flesh and see body language and things like that. But SurveyMonkey is another a method of how we start gathering our data. And of course, when you're in that ideation phase, you've got the good old pen and paper, and we still use Build, and we still use Photoshop and InVision to do high fidelity prototypes. Yeah, so I just thought I'd pull this together for people to have a look at, and this would be our, albeit high level approach to remote design thinking. Just a couple of tips that I'd like to point out. So if you are running internally a design thinking workshop, albeit remote, preparation is key. Yeah, so make sure you plan the sessions and make sure you test the technology prior to the actual event. If you're involving end users, clearly they might not be used to some of the technology that you're asking them to use. Another interesting thing, yeah, obviously you can use different backgrounds via the use of videos. I mean, Teams, you can blur it, you can use different backgrounds as you can with Zoom. And I find this very useful when it comes to, you know, your office environment. And we'll talk about the equalizers or the norm, but the office is a great kind of equalizer. Everybody's on the same playing field, whereas remote design thinking, you're not. Everybody's got almost like their own kind of universe, you know, whether it's children running around, whether you've got a laptop on the sofa, whether you have a nice office, for example. So yeah, the use of video, we do encourage video, but that can also be a challenge. The skills that you need to run remote design thinking workshops also vary from your traditional, you know, face-to-face human interaction. So facilitation skills for me is quite an important thing, especially around time management. And clearly, empathy is another challenge with remote design thinking. Yeah, so having that empathy can be a little bit more challenging over video rather than, you know, face to face, and understanding what's going on with people. Yeah, the last tip really around remote design thinking sessions: keep them short and keep them concise, because yeah, in our experience, almost the shorter the better, because people will switch off. There's almost too many distractions going on via some of these sessions. As you can imagine, it might even be deliveries coming to your house. So keep the sessions short and concise. That way more people will attend. So yeah, those are some tips and tricks on remote design thinking. Obviously, I'm going to be putting out more detail on this because I think this will be the new abnormal. And from my perspective, as I said, office working is an equalizer. Yeah, you're all got kind of, you know, similar place to work, similar desks, same equipment. The home and home life is a completely different ball game. So my kind of last point on this really is, when we are having to work remote and run sessions such as this, I think leadership is key, and, you know, being able to understand or show more empathy is even more key. So again, I'll leave some slides behind for SAP to put in the Jam site, but I thought I'd share those with you. Right, now on to the good stuff. And a demo, we'll actually see some stuff. So I'm conscious of time. I'm sure everybody is aware of what the cloud platform is and what it will give you. Yeah, from our point of view, we would describe it as the agile layer. You know, you've heard people talk about keeping the core clean and innovating in the cloud platform, and that's very much what we're talking about. Bunch of capabilities, and this is exactly our kind of sweet spot, you know, from analytics to workflow, API, integration, data management, all that type of stuff, and of course, user experience. Now, we offer Partner Managed Cloud, which are basically services on top of the cloud platform, monthly subscription. Main reason being a lot of our customers don't really know where to start, so we're there as a kind of guiding hand. Plus some intellectual property that we have, like custom applications that we will use to help the customer gain an ROI quicker. So that's Partner Managed Cloud, SAP Cloud Platform. Okay, I'm not going to talk through this stuff. So let's go back to the cloud innovation topic and show you some stuff. So one of the main drivers for this, obviously we've moved into a new design center. Okay, so what I would try to do is try and keep it as efficient as possible and work smarter. So we've got a minimum or a finite number of employees. I wanted to get rid of paper. So one of the things that we started looking at, it's a simple one, but, you know, being as we're selling products via the cloud platform to our customers, we have to kind of chew it as well. So in terms of cloud innovation, we started exploring building applications in the cloud and then using some of the database options or services in the cloud. Main reason being, as you can imagine, small to medium enterprises, they might not have, you know, your full ERP suite or your full enterprise suite of applications like success factors and things like that. So this was part of the reason for it. And my challenges as a kind of owner of the business, I wanted to remove paper-based processes, and I wanted a great user experience for my employees. So on that note, I'll let Vikash come in at this point and comment, but these are some of the drivers on why we chose some of the services. So in the examples that Vic is going to show, we're going to go through HANA DB service. And as I said, you know, just emphasizing those points, keeping the core clean. In our case, yeah, we didn't really have a core. We were going to use the SAP Cloud Platform in its entirety. But you can see I wanted to get rid of Excel spreadsheets, paper-based systems. Yeah, not to say that HANA DB and some of the customers that we work with and why they use it, it might be because they want to remove those peripheral systems. And of course, the HANA DB itself is best-in-class database. So I'm gonna let Vikash explain what we did as the first app we're going to show you, and then we're going to show you some other applications that we've built that we actually use within the organization.
Thanks, Dan. Hi, everyone. So this is our first application, which is called Staff and Visitor Application, which mainly records the staff and visitor movement. So if I'm a staff, I'm going to office, I enter office, I say this application that I'm signing into the office, and that's it, it records it. When I come back, I say, let's sign out, I'm going to my home. For a visitor, it again records all these movements. So whenever the visitor comes in, he fills in all the first information about him, and then chooses who he wants to meet. He acknowledges few of the health and safety instructions, and then he signs in. At the same time, the visitor badge gets printed, and then a host gets notification that his visitor has arrived. One thing I missed in the staff section is staffs can also sign in using their access card. So these are the two main key users for this. Even the contractors have same functionality as the visitor one. Apart from this, there is one functionality called the fire list. So in case of emergency, you can see from this particular list that who all are present in the office at that point of time. The application is completely adjustable as per the corporate branding of the customers. Next slide. Yeah. So that was the main application, but there are many other applications which support this particular main application. For example, if you want to pre-register your visitors, you have an app for that. You can pre-register visitors. They will get an email notification that their visit is scheduled. You also have application to manage staff and host. You have an application where you can see which staff has signed in at what time on what particular day. Then again, a separate application for fire list as well. And the last application in this suite is reprinting of visitor badge. So in any case, let's say the printer communication and anything is lost, then the receptionist has this app where they can just reprint that visitor up. In terms of architecture, it's there's nothing new. So if you see any application running on SAP Cloud Platform, there's a global account, sub-accounts, it has services into it. If I talk of the user journey, then user just opens, maybe from any of the device tries to open the Fiori Launchpad, it gets authenticated through user authentication tenant. And when he clicks on a tile, then that application gets invoked, which again, through the connectivity service of SAP Cloud Platform connects to the backend system. Here in our case, it's the HANA database. So primarily we have used 3 different services: user experience, data management, and the user management services on SAP Cloud Platform.
Okay, Vic, I'm going to stop sharing. Let's just give a quick demo of the app, and then we'll move on to some of the HR ones.
All right. Can you see my screen?
Yep.
Okay, so this is the Fiori Launchpad which we have. We have different types of applications over here. So all applications like UI5, Fiori, even the screen personas and slipstream ones. I'll just quickly switch over to this application, which is the visitor app, which I was talking about. So if I am a staff, I'll just click on it. Here I am, sign in. This file list shows that only Vikash is in the office. If I am a visitor, I'll choose sign in option and choose my host. It also has option to click a picture, but I'm skipping it. Then at last you have some health and safety acknowledgements. Once you acknowledge it, hit a sign in button. And you're signed in. The host, in the meantime, gets a notification that your visitor has arrived. If you see at this point, if you see the file list, I'll just upload, let me just go back. Then it'll have visitor as well as the staff information over here. If the visitor wants to sign out, you can just click on it, signed out. That's it.
Yeah, so again, the driver behind this one was I didn't like paper and, you know, these little wallets that people pin on themselves. So I took the UX team to task. I said, build me an app. Let's do some user research. Let's do some research of what products are out there, get some feedback, build it quick, get it in the cloud platform. So yeah, it works. People like it. And yeah, regarding the next stage of that development, so if I just come back to share my screen, Next phase of that development is clearly facial recognition. Given COVID-19 as well, people will get a little bit paranoid about touching devices. Yeah, lots of people touching devices. So again, Vikash, I don't know if you want to say a few words about facial recognition. My last parting shot on this one is with the fire list, the also planned innovation is to link the fire alarm, IoT, trigger me the fire list. Yeah, so that's why we kind of pick the cloud platform.
Yep, that's it. Nothing to add.
Okay, lastly, HR Suite, because I'm looking at my clock, I've got 10 minutes, so let's display something else. Vic, do you want to talk through?
Yep. So we have replaced all those Excel sheets now. We have an application, a very simple app, where we can quickly book our times. This gives you a little bit of analytics as well, like this is your target, how much you have built in, and your utilization currently. Again, this is also not one application, it is a suite of apps, and we are actually getting insights from the data through SAC, so SAP Analytics Cloud Stories on Fiori Launchpad. And this is, again, mobile ready. The second app is Leave app, where you can request your leave, you can edit your requested leaves, you can see a holiday calendar and some analytics like how you have requested leaves, what categories, what is the spread. And these are the suite of apps. So manage clients, where we manage our customers, customer data. Then resource data is managed in managed resources, where we map resources with managers. The working time, what is the work schedule, 5 days a week, 4 days a week. And lastly, it also displays what are the leaves which the resources have taken. We again have the timesheet reports, like the SEC stories, SAP Analytics Cloud Stories. And the last report is basically a report which tells you which project has how many days left.
Yeah, so selfishly, from my point of view, prior to the use of cloud platform and the HR apps, as we're calling them today at Bluestonex, prior to this, it was a lot of timesheets being collected on spreadsheets. I go back to, let's be pragmatic and realistic about it. Bluestonex as a small business partner of SAP, we're not going to be investing in that huge suite of back-end systems. So this is one of the reasons why we thought, yeah, we'll practice what we preach. We sell timesheet applications and we develop timesheet applications for our customers. So let's build one for ourselves, so our consultants can actually, manage their time. We can manage the projects and we can report on it.
So that's the first report where we see how the time has been booked by different resources for different projects and clients. And it has advanced filtering options, as it is with any SEC stories. You can explore data, you can filter like anything.
Again, Vic, I'm going to stop sharing and I'll let you give people a look of the applications that have been built. And by the way, folks, for those that are interested, because I'm not as nowhere near technical as the guys at Bluestonex, in terms to deploy applications and build applications via HANA DB, it's a lot quicker than what you would have to do with a typical SAP UI5 application and integrating it to an ERP system, for instance. It's a heck of a lot quicker.
Yep, that's true. So this is the timesheet application. You see your targets, actuals, and the utilization. You have list of projects you're assigned to, but these are just the list where I have booked time or the internal ones. If I have to go to customer projects, I just need to click on this and I'll get a list of all the projects I'm assigned to. I can just add in here and it'll come over here. There is easy calendar navigation. So if I click on any of these dates, the whole week gets displayed on desktop, but on mobile, just one day. You can save your timesheets from here. Dead easy. This is the leave application we were talking about. So let's say it says on 20th, I was on sick leave. On 22nd, let's book a day off. That's holiday. So I have two different leaves. spread across 1 and 1, so 50-50%. I get it. And then I have requested leaves. I can just edit all these requested leaves. I can maybe make half-day leave, save it, manager gets notified, and this chart also gets displayed.
Yeah, so in effect, what I tasked the team with, again, I wanted to remove me having to manage multiple spreadsheets and, you know, offline systems, should we call it. Yeah, so this is where we've come up with, it's almost like a mini HR system for the SME. Yeah, so we've got timesheet, leave requests, manage employee, manage projects, manage, all specific to obviously Bluestonex, but certainly the timesheet application and leave requests, yes, they could be integrated into the ERP S4 or ECC6.
Lastly,
so this is again another example of SAC here, Vic, yeah?
Yeah, lastly, just the build days, I'm just showing it. We have just masked these labels, so they are basically the customer names, but we have masked it. So yeah, you get the total number, total days which are booked, how many are billable, how many are not. If you want to click on and see a particular client, you'll see that these are my projects where resources have booked time. So it's a kind of filtering. If you want to see two different, you can see it. It's just slicing and dicing data on SAC. If you want to see the raw data, even that is possible, and you can see all these days by resources, by project for particular clients. And you can also filter it from here. That's it.
Thanks, Vic. Let me come back. So hopefully it gives you guys an insight into, yeah, as I said, we build applications, we sell applications to our customers, but we actually use them now, and we have quite an aggressive roadmap to continue with that innovation within Bluestonex. So this slide, yeah, I'll let Vic just explain it again, but this is the architecture that we use on those suite of applications.
Yeah. This is pretty much the same, except for the fact that we have used SAP Analytics Cloud.
Yeah, and obviously those apps, some of those apps that you've seen now, they're actually going onto the App Store. So keep your eye out for those that are interested. As I said, from my point of view, as owner of the business, I need to make sure that the team is efficient. And you know they're able to do things quickly rather than scratching around looking at Excel spreadsheets. HANA DB, or in fact other DBs available in the cloud platform, plus the Fiori design standards via the portal, is a very, very nice way to innovate. Start stripping out some of that peripheral, manual ways of working, or even peripheral databases, and whether you integrate them or not, yeah, that's up to you. In our case, it's a lot simple. We'll just hold everything in the cloud. On the apps that you've had a look at, obviously timesheet apps we've integrated before, very similar to the one that you've seen. The visitor app as well, we've integrated into SuccessFactors. So this is why the SAP Cloud Platform is brilliant. So you can integrate, but you can also do this stuff as well, which to me is innovation. It saved us a lot of time and a lot of energy. So I'd take you through other examples of customers where we've taken them to the cloud and we've innovated and done all this stuff. But yeah, I'm sure you're sick of my voice by now. I will leave it there and finish slightly early for you, Taurus, because I'm good like that. And,
so we have a couple of questions, Dan and Vikash. We have a couple of questions in the chat. So the first one from Prakash, how are you managing users? Are you creating SAP user IDs for all staff? And then there's one from Narendra, are all the tile applications design-led custom apps?
Okay, Vic, take the first one.
Yeah, so the question is how you're managing users. Yeah, so all these users are created in user identity tenant. We are not creating any user in SAP because obviously we have said earlier, we are not using SAP ERP for any HR applications. It's completely custom. Second, are all the tile applications designed?
Yeah, I think I can take this and you jump in, Vic. So yeah, they are design led, even the custom application. So where it is sensible to, obviously we try and follow the guidelines of good design and the Fiori guidelines. As you can see from our our visitor app, no, we broke the rules because I can, and it was based on feedback as well from visitors. You know, things like icons instead of text, we kind of reverted back to not doing it how you'd expect to do it. But yeah, everything else that we do, certainly customer focus will always be design led, and we will follow design thinking methodologies, if that's what we meant by that question.
Great. So if you guys have any other questions for Dan or Vikash, please either unmute your line and ask your question or type your question in the chat area. Okay, seems like we're done with the questions. Dan and Vikash, if you guys can just add your emails to the chat area. So if you guys have any questions for either Dan or Vikash, you can directly email them and ask your questions. Okay, so let me just quickly share my screen and we'll wind up the session. So thank you again for joining us for the May edition of the SAP Fiori Practitioners Forum. Please join us again next month on June the 18th. We have a couple of other great sessions lined up for you, and the next session from SAP's Learning Update will be the UX roadmap and strategy and Fiori 3. We're trying to line up that session for you guys in the month of June. So join us again for that great presentation and another customer or partner session that we're lining up for you. And with that, I want to thank you guys again for taking time out of your busy schedules to join us. Have a great morning, afternoon, or evening, wherever you're located. Talk to you next month. Thank you.
Thank you.
Thanks. Bye.
Thanks.